everyone, my name is Ariana. I'm part of Group 1, and today I'll be talking about stimulability and the basic components of the stimulability approach in speech-language pathology. Stimulability is a child's ability to imitate a speech sound when given a model. It helps determine whether the child has any capacity to produce a speech element, such as a consonant, vowel, and a syllable. Stimulability testing is one of the most commonly used assessments and helps guide clinicians for their treatment sound selection. Clinicians often consider two key areas when choosing a treatment sound: stimulability and speech knowledge. A stimulable sound is one the child can imitate, and a non-stimulable sound is when a child cannot produce the sound under any circumstances. With younger children or those who get frustrated easily, it's most commonly seen that clinicians often start with stimulable sounds first to promote success and confidence. The stimulability approach is used for children with very limited phonemic inventories who are not yet stimulable for many sounds. The goal is to not get perfect production, but to increase the number of sounds a child is willing to try. There are three basic components of the approach. The first one is sound character pairing. So each sound is linked to a fun character, gesture, and or visual. For example, the k sound can be introduced as the coughing sound, or the ch sound can be introduced as a spray sound. Now, the second basic component is multisensory cueing. Children are supported with auditory, visual, and tactile cues to encourage sound production. Last but not least, we have play-based practice. Sessions are fun, low pressure, focusing on sound exposure through games and activities, and kids are praised for trying, not for being perfect. And that summarizes the stimulability approach. Thank you.
Hi. So like Ariana had mentioned, the stimulability approach is about empowering children to produce speech sounds that they have not yet mastered, using a combination of cues, modeling, as well as supportive feedback. And this activity aligns well with this therapeutic framework for several reasons. First, the activity is engaging and it is interactive, which is very crucial to maintaining a child's motivation as well as their participation throughout the session. When children are actively involved and they are enjoying themselves, they're more likely to take risks and take up those challenges to attempt those new sounds. The willingness to experiment is at the heart of the stimulability approach, which does seek to build a child's confidence in their ability to produce those unfamiliar phonemes. The structure of this activity provides repeated varied opportunities for the child to hear, see, and practice those target sounds. And the repetition is a deliberate strategy to reinforce those correct sound production and promote phonological awareness. The SLP integrates both visual cues, such as watching the clinician's mouth movements, and auditory cues, which is listening to the correct sound. The activity addresses multiple learning modalities, which we have come to find out that research does suggest that it is very effective for young children. And another important aspect is the importance of feedback. This activity allows the clinician to provide real-time encouragement and the correction, which does help the child adjust their articulatory patterns on the spot. And this immediate feedback loop is essential for reinforcing successful attempts and just guiding the child towards more accurate pronunciations. Finally, because the activity is playful and contextually meaningful, it does support the generalization of new sounds beyond the therapy setting. So children are more likely to use these sounds spontaneously in their everyday communication when they have practiced them in a fun environment. Overall, this activity does exemplify the principles of the stimulability approach by fostering an engaging and supportive atmosphere, and offering multiple opportunities for practice, utilizing effective cues and feedback, and just promoting the transfer of new skills to a real-world context. yeah, now we will go into the activity.